All right, welcome back to our table talk. We are going to talk a little bit about what goes on in our office, especially in the back end of our office, where we do a lot of our physiotherapy. And what is physiotherapy? Physiotherapy is to kind of help facilitate and help you speed up the healing process by getting rid of inflammation, by relaxing the muscles, and in some cases, we'll decompress the spine or we'll try to straighten it out as well. So, to give you a little bit of the ground tour, we have a bunch of, in the back here, TENS units. Okay, these are to help relax the muscles and with ice help push out the inflammation. So we'll use stim units to do that. And if you come on over here, we also have these two tables over here, which we do our scoliosis treatments. So scoliosis treatment, not all chiropractic offices do scoliosis treatment. We happen to do it. We're one of the only ones that I'm aware of in the Central Valley that does scoliosis treatment specifically, and we have a lot of good success. So what we'll end up doing is we'll find out which side it's kind of curved on. There is a Goldilocks period of time to do scoliosis treatment, and I usually, it's around somewhere around between 11 to about 35, 36. That is when the spine is most flexible, and so we'll end up using these tables. Sometimes we'll end up using weights as well, and we'll kind of strap them in, and if we need to, we'll change the setup as we go along. And x-rays are definitely necessary to help us accomplish that goal, to make sure that we're on point. Now, if you come on over here, we also have a decompression machine. And what's really nice about the decompression machine is that this right here is the bottom half. This is what pulls, and this half does not move. And we'll end up having that, and it'll help kind of stretch out and decompress the disc in the spine, and allows us to kind of also flush out any inflammation in that area and get the pressure off there and increase the height of that disc. Okay, and so this little bottom part here rolls on a track, and what's nice is that this machine here is very mechanical. I can set in the exact parameters of which I want, if I want a certain amount of weight pulling, and for how long I want it pulling for. So this is like the inversion table met the 21st century, and allows for pumping of that disc. So this is what this is good for. Come on over here. We also have a ultrasound machine. The ultrasound machine helps go in there and kind of break up scar tissue. Scar tissue is kind of like glue. Think of it like glue all in between the muscles, and the muscles aren't allowed to freely move between each other. And so we'll end up using something like an ultrasound, and with a little bit of gel, and we'll end up rubbing that wherever we need to in order to kind of break up that and facilitate the healing. It does kind of release a little bit of inflammation as well, because we are breaking up things, and so sometimes we'll chase it down with a little bit of ice. But ultrasound is very useful, and is sometimes useful in complementing what we do as far as healing. You don't really feel much other than the heat. It is sound waves going in there and breaking up the scar tissue. And it's not like the ones where you come here and you kind of check and see what the baby looks like. This is actually therapeutic ultrasound. So it's going in there and it's blasting those tissues with the sound waves. So not the same thing. And all of the TENS units, they have these little patches here, and where we can put them exactly where we want them on the spinal areas that we need to affect, and sometimes the extremities as well. So this is what it kind of looks like. We'll end up putting those patches. It's very similar to the home kits that you can buy as well. They're called the TENS unit. So these are useful for getting rid of inflammation and relaxing the muscles. Sometimes when we're doing stuff like decompression or the scoliosis, we'll also use something like this. This is called IST, the intersegmental traction, and that is good for the paraspinal muscles, which are kind of right here. So it kind of helps after you've had your spine being straightened out or pulled. Sometimes it does get a little aggravated, and so this helps kind of calm those muscles down. And last but not least, we're going to come on over here. We also utilize vibration therapy to help assist our patients. Sometimes the back is really, really aggravated, especially when doing decompression or scoliosis treatment, or just in general. When we're trying to do an adjustment, it can be very, very tight. People drive a lot, or they do a lot of jobs where they're lifting, such as construction or something. And this is very useful to help kind of quiet down the muscles and allow them to relax. So typically we'll have our patients stand on this and it will jiggle. And what's really nice about it is that it's going to help increase the circulation and decrease those pain pathways. Kind of like if you were to bump your arm on something and you rub it, it is that same principle. You're actually beating the pain signals up to the brain. And so vibration therapy is really good at kind of quieting down all of that low back pain. And it's really good also if you're on your feet a lot, for the knees and the feet. Okay, so we'll use that as well. So I've given you the grand tour of a little bit about what we do as far as the physiotherapy in our office. Hopefully this was informational. Take care, guys.